Hello guys, how are you all? I hope you all are doing good. Very warm welcome to today's discussion session on the introduction of FCPS talks and OSCE exam for October 2023. I know this is a very difficult exam for some of you, while after giving the written exam, it is a different format. And you all have some queries to clear that how you are going to approach this exam. Very warm welcome from RFA Tutors team. We have arranged this session to clear all the queries so that you have a very clear idea that how you are going to approach this exam. So we are here. I am Dr. Anam Umair. I am from RFA Tutors team. With me, we have Dr. Gauri, Dr. Shabnam, and we all are here to clear all the queries you have for this exam. So guys, how are you doing? Hello, Aisha. Hello, Poonam. How are you?
Hello, ma'am. I am fine. Thank you.
How are you doing, my dear? How is the preparation going on?
I'm trying my best, but I think I have a lot of deficiencies still left, but I'll try, inshallah.
Yeah, I understand, my dear. It is a difficult situation when you start for the preparation and you don't have idea about it, what you are going to do. So don't worry, we are here. We will clear every query and we'll try to guide you about the right direction, okay? So don't worry at all. How are you, Poonam?
Thank you.
Ma'am, I'm fine. I'm also doing the preparation, but it's slow now because of the job and other things.
No worries, my dear. We will start our live sessions for all the stations, important exam-oriented stations on 24th, and then we will practice all the important stations, and you guys will feel much more confident after all the stations which we are going to do. Okay, so don't worry at
Okay,
all.
ma'am. Thank you so much.
Okay, my dear. Thank you all for joining in the session. So I know that it is a very difficult thing. You all have started this journey from your medical school, and then you opt for the gynae. You give your part 1 exam, then you have a very hectic training, all on-call rotas and everything. It is very difficult thing which you all have done already. Then you appeared in the IMM exam, you passed the exam, and then for FCPS written exam 2, you all have made it. So this is the final step for FCPS obstetrics and gynecology. So as you all have done very well in all the previous steps, so in this last step, this is the last step to achieve your goal, to achieve your dreams, to be the FCPS consultant. So don't lose your hopes, keep your morale high, and just give a final push to your preparation to pass this exam in October 2023 in the very first attempt. Okay. So what you guys think? Is it doable or not doable? What you feel up till now while you are preparing for the exam? Any one of you?
Ma'am, sometimes we think like it's doable. And sometimes again, when the difficult topics came, when we don't know about the questions, then we think like that we cannot do it.
Ma'am,
Ma'am, in
the
the
problem
theory
is,
exam, I appear in the MRCOG part 2 in the July, but unfortunately didn't clear the exam. I got the 60 percentage in the exam, but that study helped me in the FCPS part 2 theory also. So I
Exactly.
cleared in the
All right. Don't worry at all. You will definitely gonna made up for MSG part 2 in the next attempt. Because whatever knowledge you already have, that will be helping you as it has helped you in the written exam. It will help you in your talks too. Because the talks exam is basically an exam of your knowledge, which you are going to implement on some scenario, on some patient. You are going to demonstrate what practical skills you are having. Okay, so all the knowledge which you have, this will definitely help you now as well as at every step of life. So don't worry at all if you are not able to meet in July. definitely you're going to make in January or any next attempt which you are aiming for. So don't worry, my dear. Actually, every one of us has some scenarios in our life, has some hardships and difficulties which we have to face and which we have to overcome. So everyone, every single student has same scenario. Everyone feel it difficult. Everyone feel anxiety, stress, depression about the exam. Everyone feels that we can't do it. But believe me, it is a very much doable exam. If you prepare in a sequential manner, in a targeted manner, there is no way that you can't make it, because it is not that much difficult. Okay. So let's see that what are the components of the exam and how we are going to prepare for it. So what we are going to discuss today, we are going to discuss about the exam format, the types of stations, which modules you are going to cover, how to prepare for the exam, which study material you need to cover, and how to make it in one go, how we are going to squeeze everything in a single bag, so that you guys are at least familiar with every important exam oriented station. Okay, so let's see what is the exam format. So guys, in this exam, you are going to have at least 12 to 14, mostly 14 stations. Each station has 10 minutes in which you have to cover that station. And that includes reading time also. You will not be giving any extra reading time. You have to move to the station when the bell rings, and then you have to read the scenario very carefully within 30 seconds to 1 minute, because the scenario will not be that long usually. It will be very targeted and small, and you will be able to understand that what they are trying to ask. After reading, you will be attempting the station, whatever the station will be, whether it is a structured discussion. You will be having six structured discussions with the examiner. Mostly they are 3 gynae and 3 obstetrics discussions. And in that structured discussions, you will have a scenario and couple of questions down below. And then the examiner will be asking the questions one by one. It could be history taking, and then the investigations, and then you can be asked about the proper management plan. Anything, they can have some different targeted questions too. But the structured discussion basically is a little bit easier than the other parts, if you have a proper background knowledge and proper concepts of all the important topics. Next type of stations are the skill stations, in which they can ask you to perform any task like vacuum delivery, forceps delivery, like inserting the Mirena, and they can be any teaching station also in the skill station, like demonstrating and teaching the POPQ to your junior, or you can teach the stitching of episiotomy. You can teach the mechanism of labor to your junior. All these skill stations, either you have to perform in front of the examiner, or either you have to teach your junior. In both ways, you have to demonstrate your practical skills, that you know that how this procedure is needed to be performed. Okay? Is that clear up till now? Okay.
Yes,
Yes,
ma'am.
ma'am.
Thank you.
Okay, thank you so much, my dear. Thank you. Let's move. Next stations are, there will be role player stations too. There could be 2 or 3 role player stations in which you have to take the history from the role player. The scenario will be given. And then after taking the history, you have to discuss the investigations and management part with the role player. Okay. So in this manner, you have to cover all the history, examination, investigation, and management part with the role player discussion in 10 minutes only. There could be also some gynae board or labor board. In gynae or labor board prioritizations, you have to make sure that which room or which patient is very important or top urgent, which you have to deal with. And then you will be going room-wise and you will be discussing with the examiner all the important management point of that patient which are required at that time. The last thing is there could be one clinical audit, article appraisal, or any patient information leaflet appraisal station 2, in which you have to discuss the pros and cons, good points or bad points of that thing. Now, the most important are the 4 stations, which are actually on the real patients. You will be having the 4 stations will be like that. You will be having one obstetric case and one gynecology case. In the obstetrics case, you will enter the cabin. You will be having one patient and you will start taking history. You will not be given any scenario that which patient is this. After taking the history, you will perform the examination, including the general physical examination and the specific examination on the patient. And after history and examination, you will be summarizing the patient to your examiner in that cabin. 10-minute station will be done like this. Then the bell will ring and you will move to the next station. In the next station, you will be discussing the investigations and management plan of the previous patient with the next examiner. You will be discussing the whole management plan. So in this manner, one case will be covered in 2 stations in the circuit. Similarly, next 2 stations will be of the it could be any gynae case. It will be some gynae case. So you will be having both obstetrics and gynecological cases on real patient too. Okay, is that clear so far? Any query, guys?
Yes, ma'am, cleared.
Okay. Thank you, my dear. So this is the basic structure of the OSCE exam. What are the domains or what are the different scenarios which you can encounter in the exam? It will be some history taking an examination. It will be dealing or demonstrating some basic technical skills like some abdominal examination, some taking the pap smear or applying the forceps. These are included in the basic technical skills. Then there will be in some stations, it will be complex technical skills. Complex technical skills include the maternal collapse or resuscitation, neonatal collapse or resuscitation, or it could be some management of PPH or eclampsia. These all are the complex technical skills which usually involve a teamwork. And while discussing with the examiner or while performing on some mannequin, you have to speak up about the team management role, like you have to call for help, you have to ask some colleagues to note down the event, to help you in the management, all these things, although there no team will be present, but at least you have to talk and you have to speak up to the examiner so that they know that you know about the teamwork and team task. Okay. Next, it will be dealing with a difficult patient. There could be some role player who is angry or who is sad or who is crying. So you have to deal some with difficult patient. It could be some breaking bad news too. So this is how you have to complete one task. Next, it could be some counseling stations, some shared decision-making stations in which you have to discuss the management plan with the patient. And in clinical governance and risk management, you will be having audit or risk management tasks. In some station, you could have some emergency contraception station too. So these are the different domains or different skills in which you have, which you can have in your exam for the task in the station. So let's see next that what we have. So these are the journal component which you have to note down and which you have to complete in every single station. Like information gathering is the important part in which you will be judged in most of the stations, like in the role player stations, in the real patient stations, in the structured discussions, in which you have to tell the examiner what important history points or what important investigations you need for that scenario. So the information gathering is the domain, is the component which will be tested in most of the stations. So you have to have a very good grip on history taking and what are the important examination findings you need, and what are the important investigations which are required for that specific patient. Next is the patient safety, which is very important because patient safety point usually included in every step when you have interaction with the patient. Like information gathering, you will have to ask some important things which are included in the patient safety, which we will be discussing in a while. Similarly, while discussing the management with the patient, you have to keep a note of some important points which are included in the patient safety. So patient safety points, usually you have to keep a note, you have to remember throughout the station. Next domain is communication with the patient and colleagues. Communication with colleagues is generally an easy task because you just have to involve the team. You can just speak up that I will involve the team, like my consultant, any other specialty you require, any staff nurse, blood bank, anesthetist, anything, any other person, any other specialty for which you need the help from, you can mention and the component is done. You will be marked for that. And communication with the patient is all the communication in the whole station which you are having with the patient is the communication with patient task. And you will be assessed about how you approach the patient, how you talk with the patient, and how you are dealing with the patient. Okay. So we will be discussing this in detail in a while, but this is another important component. The last component is the applied knowledge. Applied knowledge is that what important management points you are going to discuss with your patient, or anything which is related to the that station from your knowledge, from your guidelines, from your talk articles, all the things you have to implement it. After the components, you will be marked in each component separately. Like you will be given in the station that in this respective station, which domains actually you are being tested for. Okay, so we have these domains, and in these domains, like you are being tested for the information gathering in the station. So for the information gathering, the mark sheet will have certain points that in this patient, for example, you have to cover this 6 or 7 or 8 important history points. When you will speak up those history points while talking with the patient or while discussing with the examiner, you will be marked for that specific point only. Okay, for example, if you have a patient with heavy menstrual bleeding, you will be taking the history of about the heavy bleeding, and then you will be marked about that point, whether you are good or you are borderline or you didn't ask. If you didn't ask, you missed the point, you will be marked 0. if you ask the questions, but you are not very good or very specific in asking, you will be marked borderline. And if you are good and you have covered that part very well, you will be marked 2. So this is the scoring system in which you will be marked 0 or 1 or 2 for each specific domain and for each specific question. So you have to make sure that for each component, you have covered all the important points which are given in the key. So this is very important, so you don't miss any important point in each station. And definitely in our course, for each important station, we will be covering the key points which you have to cover. Is that clear so far? Guys, any query
Yes.
up till now?
Thank you.
Okay, guys, thank you so much. So now Dr. Shabnam will take over, and she will explain about the further details of the components. Dr. Shabnam, please.
Yes, thank you, Dr. Anam. Hello, everyone.
Hello.
Dr. Anam nicely explained regarding the previous slides. Basically, what I feel that this is exam, even the pattern is changed. So you guys have more chances of passing this exam, isn't it?
Everyone
feel-
says so. Everyone says so that it's easier, but the problem is that we have to now cover every little unimportant topic also, and that's the big deal. That's the problem.
But see, in the previous exam, there was only 2 long cases, and they were just because no one can judge by just asking 2 long cases, like one with a prolapse and you just gave the other with the ops history, the diabetes and pregnancy. And if you fail only one station, it doesn't mean that you are not a good consultant and you are not able to a capable student to pass this exam. But here at least there are 12 and 14 stations. So if you not perform good, or even if you perform borderline in 2-3 stations and you perform maximum in 7 to 8 or 9 station, then believe me, this is so easy and you guys can easily pass. What do you think, Gauri and Dr. Anam?
You're right. I think so. You're right. But the problem is that suppose in last exam Vizyco, you're trying fistula and idiopathic intracranial hypertension, and these sort of topics also came as a full station. So that worries me, to be honest.
You are right. Actually, the pattern is changed. Previously, what we were supposed, the CPS students, the senior were giving us that do this 10 stations from the ops and do this from the gynae. It was like that from the beginning. So it is different. Now for the OSCE, like for the 12 to 14 station, we need to cover, like in the MRCOG 3, we need most of the guys you maybe appeared in MRCOG 2 or 3 as well. So in that situation, we have to cover as a whole modules. We will not leave anything, like there will be, I think we can't left any module untouched. It is like that.
Right. You're right.
So previously we were supposed to prepare 10 or 20 stations. That was all. Basically, that was what I feel that it was not a good criteria. This is the criteria that they are judging us on a simple things. Like, see, the information gathering. We usually ask so many things in the information gathering, but here, like if you got only the short case, like the ops case or the gynae case for with a patient, and you give the IVA on the other station. So in that situation, you have a maximum time, like a 10 minute. You can take everything in that 10 minute. Even if it is like a SPT stations where you can even take a history as well as you will tell the patient about the management. Even in 10 minutes, you guys can cover with the practice. It is even easy as compared to the previous exam. But in the short case, like where you will only the ops case and the gynae. So in that situation, you will need even a very, very small things information gathering. In that situation, you don't need to miss anything. Like in SPT, you should be specific with the history of information gathering. But in the other case, you will take every and each point. So in the information gathering, what you do, we will start with the presenting complaint, like We usually do that. And once you started with the history of presenting a plate, give the opportunity to the patient, to the role player, in an open-ended questions, so that the role player will be counseled that what to speak and what not to speak. So the role player, if you give her the opportunity to speak, then definitely she will tell you maximum. And once whatever the role player will tell you, please just keep in mind, you will not speak or ask the role player again. It means that you are not listening to the role player and you just focusing on your own template. Got it? Hello.
Yes, ma'am.
See, if you ask that how much you are bleeding, if the patient says, yes, I'm soaking 10 pads or like this, and you again say how many pads you are using. So it means that you are not listening your role player. Whatever the role player, the patient want to say, talk to you, you just don't ask it again from the patient. Dr. Hori, please show me the previous slide. And if in the if it is like a routine, if it is an obstetric case, after that you continue with the obstetric history or detail like the mode of delivery, the age of the, if the obstetric, the age of the child, all that. And the gynae history, you need to ask about the cervical screening. You need to ask about the previous contraception. So all that is important in the gynae, and definitely the LMP, that all important. In the medical history, if there is any medical history, then definitely you need to ask detail about that. That when was your last visit? If she is a hypertensive, you need to ask what medication she's taking. When was the last visit with the doctor? And how is the control? Any current symptoms, like if she's diabetic or anything like that. And is she's following any specialist for that, or she's just going to the regular GP for that? And any family history that is important, you need to ask in the information gathering. Next, please. And the surgical, you need to ask any previous surgery in your tummy or down below. The drug history is important. Medicine and allergy. Allergy is very important because it is a big safety point. The personal history, the smoking, alcohol, and recreational drugs, which we usually not going to ask alcohol about the drugs over here. We just ask about with the signpost. You can ask about smoking, but the alcohol and recreational drugs, we are not going to ask over here. The social history, it is important. What do you do to live? How is the support at home? Like all the way we are doing over here. The mental history, it is like in our setups in Pakistan, we usually not focusing on the mental history, but believe me, it is very important. If we say every second and third of our patient, he is a case of almost depression, or she's not going to open up so many things, we need to ask so many questions and then she tell only one answer. So the mental history is important. You need to ask about that. And if any result that is given, you need to interpret the results, and you need to order the investigations, and you even review records and encouraging the patient for questions in between. If she's not understanding, then you can encourage that if I'm not clear about. And meanwhile, while you are taking the information gathering, communicate with the patient so that it is important. Next, please. Communication with the patient. You will be checked in each stations for the communication with the patients, and even communication with the relatives as well. In the history taking, like discussing the diagnosis, communicating the results, breaking bad news, and knowing when, where, what, and how to and not to communicate. Dealing with angry patients and relatives, they all are important in terms of the communications. In applied clinical knowledge, you interview and clinical examination skills that you will be checked, and proper examination and evaluations, that is important. And you need to use correct clinical methods systematically, appropriate exposures and re-draping, that is very important, that how we are taking care of others. evidence base of practice, limitation of evidences, guidelines and protocols, and familiarity with the current literature and guidelines. So applied clinical knowledge, for that, you need to know all about them. So whenever you are communicating, like, for example, you are telling to the patient about the ultrasound report, then this is important. You tell that I have confirmed your name and age on the report. So it means that you are a safe doctor. And document allergy, that is again important. It is a safety point. In ops history, it is important to ask for the blood group, because if someone is negative, then you should be take care about the NTD. You have to counsel for that. The call for help, when to involve seniors, other specialists, and understands the limitations of your experience. Because you are appearing this exam as a registrar, you are not appearing as a consultant. So whenever, this is a very good point in this exam, that nobody is expecting that you behave like a consultant. We are just senior registrars in this exam. So whenever we feel that this is something we are not knowing, we even in a structured discussion, in a SPT, we can say to the patients, then I will discuss with my seniors and then I will let you know. And decision making and the confidentiality, that is very important in patient safety. So that's all from my side. Dr. Gori, you can take from this point onward. Anything which I'm not clear about, or you guys want me to repeat for you people? Dr. Gori.
Hello, dear. Yes. Hello, dear all. Thank you, Dr. Shabnam. So till this point, everything is clear with all of you, or any query? Any query from Dr. Anam or Dr.
Yes, thank
Shabnam, you can ask. Clear?
Yes, thank you.
Yeah, so till now you understand that what are the different domain and how we can ask different points and how we can get marks in each domain. So the point is we need to cover all the domains, different domains. For example, if you have taken the history from the patient and you complete your full history template very well and everything you have covered, you will definitely get marks in your information gathering. That is only one domain. But make sure you have limited time, like 10 minutes. Okay. So in 10 minutes, you have to think that this is not the only domain that you need to cover. You have to focus other point. If your history is very good and your communication with the patient is not good, so definitely you will not get marks in your communication with the patient. And in some station, you need to involve communication with the relatives. So we will discuss further in detail in which case scenario, and we will discuss in our live sessions also that in which case scenario you need to involve the relatives also. And don't forget your senior, don't forget your consultant. Even though all of us, we have done job in the labor ward, in our post emergency duty, we are not the alone who will take the decision for every patient. Definitely, evening times consultant are coming or on call team is coming or RMO is coming, they are doing the round, and we need to discuss with them each and every case. So same formula you have to apply in the exam. Don't say at each case that I will do everything. We are not alone on the floor who are the responsible for the patient. So this is the point, we have to involve communication with senior, communication with colleague. That colleague, even though is your nurse, even though is your junior, your midwife, your senior who is postgraduate 4 or postgraduate 3 student, whoever is there with you, or your junior is there with you. So we have to involve all our team members whenever we are managing like labor ward or gynae ward scenario. So we have to involve all our team members who are there with us on floor duty. And don't forget your consultant also. If you need any help, anytime you can call your consultant, and even though anesthetist also. So this is the meaning that if your information gathering is good and other domain is you have not covered, you have not involved, definitely you will not gain marks. Ultimately, it will affect on your overall result. So this is the point, you have to focus on your history points, examination, investigation, management, and in management, you have to involve patient itself and relatives and our seniors, and accordingly you have to fix your and complete your patient safety points also, which was already discussed by Dr. Shabnam and Dr. Anam very well, that what are the safety points. Further, we will discuss in detail. So now the thing is that most of you, they're telling that nowadays exam is tough and it is not like before only 2 case. You are very right, but passing ratio is here more as compared to the previous exam. Why? Because here you have 12 to 14 stations. If you will not even to complete 2 or 3 stations, or you are getting borderline, even though you have more chance to pass your exam. There is vast material, I can understand, and it is also difficult to remember all the points from the guidelines and talk, because nowadays their pattern is same like MRCOG part 3. So I would suggest you, first of all, make a list of what are the important topic and what are the exam question. Make a list of all those topics, OSCE cases and gynae cases. Then see what guidelines are available. Okay, which topic guidelines like GTG guidelines, NICE guidelines, and patient information leaflet, and few important talk. I will not suggest you to read all the talk of all 5 years or 8 years. No, there are some important talk, especially those stations who are repeatedly coming in the exam in different way they are coming. So kindly read those talk. If you have any query and if you are not getting talk from where to get, don't worry, you can message in the group. We are here to help you and will share all the talk material and will share all the guidelines. And it is already in the open group also. Books, there are MRCOG part 3 books also and some FCPS books also. You can see most of the stations which was shared by the students, which we saw, all these mostly from MRCOG part 3 books. Talk also most important talk, like you are telling that ICT came and this station came. So these all are talk. And I would not suggest you to read all the guideline in detail. No. If you see green top guideline or NICE guideline, only just read recommendations. That is more than enough for the exam purpose. Don't go into detail of each guideline. Only the bold lines are there. That is more than enough. Sometimes some important point is written in some guidelines, but overall, only this bold lines, it is more than enough if you remember, just for your simulated patient task and structure discussion. And you can go, if you are thinking like most common topic, like in the OPS case, you can see hypertension is very common in Pakistan. Diabetes is very common. Anemia is very common. So what are the common obstetrical case? And placenta previa, previous 2 cesarean, previous 1 cesarean. These are common cases which we routinely saw in our daily basis in our ward. If you see, these topics should be on your tips. So that's why I'm telling you, you can have a list of all the important topic, and those topic you have to remember on your tips. And if still you have any query, feel free to ask any question 24/7. Help is available, me, Anam, Shabnam, anybody who will be free, who will give you answer of your queries. Clear everything now? Aisha, Poonam,
Yes, thank you.
yeah, please give
Yes, ma'am.
response.
Thank you so much.
Yeah, if anything is not clear, you can ask. So the second thing, most of the times we are worried that how to pass. This is my second attempt. This is my third attempt. This is my second theory. So you have to be, first of all, confident. Don't worry that this girl passed in first attempt. Why I'm not able to pass? This is my second, third. Don't lose hope. Okay, so this is all over the day performance. When your day will come, definitely nobody will ask you how many attempts you gave and when you passed your exam. Don't worry at all and be confident till you get your degree. Okay, so now as we discussed that how to start, you have to go through the guideline, you have to read the important talk. And second thing, just I want to ask you, daily how many hours you people are studying and how many stations you people are doing in one day? Anybody give me the answer?
I can manage only 5 topics per day. That too very difficult, I think. So with my job and kids.
Yes, I totally understand. Yes. So 5 topics you are reading or 5 topics you are performing the station?
No, I try to cover 5 topics, but that's just a read. That's not the final touch. I mean, final touch is missing almost in every topic that I have done till now.
So that is the thing. Now see, that's I'm telling you, only reading is not enough. Okay. So my suggestion now, whoever your friend or I don't know, some students, they are having a habit, they want to read alone only. Some people, they want in group, they want a steady partner. So whatever your way you can follow. But my suggestion, if you are reading, okay, at least you can read 3 or 4 topic, no problem. But I would suggest you at least 3 to 4 stations you can perform either alone or with a steady partner.
You're
See,
right.
only
You're right.
if you will read alone, nobody will know how you are reading, what are your mistakes and what are your weakness. But if you will discuss your topic with your partner, study partner, then that lady will tell you what is your weakness and where is the lacking point and how you can improve. This is the way. See, here, this is not the only one case. Here 14 stations, and in 14 stations you will be assessed for different domain. So if you will not perform in front of others, how you understand where is your lacking point? You got my point? Hello.
Yes, yes,
So
yes.
this is my suggestion. Find your study partner and at least 2 or 3 stations, and before the exam at least 4 to 5 stations you people have to cover with each other and give feedback in the positive way. Don't take in the negative. Take it as a positive, and where is
We
our lacking points that we improve. Yes.
sorry to interrupt you. Sorry.
Mm-hmm.
We have 25 days total left till our exam. 16th email has come, final
Yes.
confirmatory email. So total 25 days. So if we do 4 topics, we prepare 4 stations in the final way. Do you think that will be enough? I think topics will still be
No,
left
that's
at
something.
the end.
Now you have 25 days. So you have to take off from the hospital at least 15 days, at least if they are giving you.
Yes, yes, yes. You're right.
Yeah, at least 15 days, then 10 days, sorry, 10 topic in one day. Then 5 topic is not enough. 5 topic is the routine. If you are starting your preparation 3 months before, 10
Yes.
topic, once you have booked your exam and now you have only 1 month. So in that 1 month, at least 8 to 10 topic one day with steady partner with proper feedback, and where is your lacking point, what is your weakness, and those weak point you have to write in one paper. The same mistake you will not do in your next station. In that way, in the exam you will remember your weak points, that I have done this mistake, so this is the day I should not do the same mistake on the exam.
Yes.
Then only you will understand what is our weak point and how we can improve our points. And again, whenever you are doing station with your study partner, with your friends, and if they are giving you more negative feedback, take it as positive. This is for your benefit. This is for your benefit. Otherwise, only if they are giving you positive feedback, we cannot improve ourselves. We will not understand where we are lacking. So take it
Till
positive.
now, I have
Yes.
been very busy. I couldn't post my audios in the group, but from now on, from tomorrow onwards, I'll try to post a couple of audio messages, voice notes, 10
Sure,
10
sure,
minutes
no
voice
problem.
notes. Okay.
Yeah, this is only 10 minutes. That's why I'm always messaging in the group. Please take a benefit of the course. Otherwise, there is no benefit. See, we all are
Yes.
here to give you, and immediately we are giving response.
Yes, you're
So
right.
post your audios, and me, Shabnam, and whoever free, we are ready to give feedback. Okay?
Okay.
Clear?
Thank you. Thank you.
Thank you, my dear. So this is the only solution which I have discussed with you, how to do, what to do, and how many stations you need to perform. And in this way, you will definitely pass your exam. No need to worry, okay? And whatever,
Do you
if
think
anybody is
still,
having,
if I manage to do 7 to 8 topics per day, and still, I mean, I haven't finalized any topic till now, to be honest, except a few topics. So, do you think 25 days are enough?
see, we have to be positive. It is all about luck. Maybe whatever the topic you will read in these 25 days, and from those that day it will come.
Yeah. You're
Okay?
right.
That is all about day performance. That's I'm telling you, whatever now you have, we have to focus on that. Forget past. How many attempts you people have given, forget everything. Whatever you have now, you have to focus on that point. You have to be confident. You have to practice daily. Practice at least if you have time 8 to 10 station, and you have to come and make a proper plan. If you will make a plan, that's I'm telling you, write all the important station. At least try to cover 50 to 60 obstetrical case, 50 to 60 gynae case. 100
Yes.
station, if you count 10 station in one day, how many days? 10 days.
Yeah.
But you have to proper plan, and you have to be dedicated with yourself. Don't think today my duties went tough, so I want to sleep. No. If you want to pass, you have to be give time to your study. Clear?
Also tell us that if we do just on Justin Kunji MRCOG 3 book, because I think the time is very little time is left and only one of the books can be done. Will Kunji alone be enough, or have we to do
No,
other books also?
no. Kunji alone is not enough, because there are so many important stations in the Oxford book and so many important stations in the Lisa book. So I would suggest at least try to cover whatever the exam station came, exam station in the FCPS came. Try those stations to cover, and apart from that, Kunji, Lisa, and Oxford. I will not tell to complete all 3 books. No, whatever the important station. If you want, I can send you the list of important topic. I will
Yes,
share in
please,
the groups
please,
and you can
please
follow.
share in
Sure,
the
no
group,
problem.
please. Thank
Yes,
you.
I will share what are the important topic at least, and see. Think what are the important and common cases you are seeing in your daily routine in Pakistan. Okay.
Yeah.
Those cases only they it will come in the exam. They will not give you high-fi case, only the common cases. So at least try to cover like forceps, kiwi, marina, pupil biopsy, MVA. These are the common stations. Shoulder dystocia. So these drills should be on your tips. And see, if you will go one day to the hospital with your study partner, you will cover this 10 topic in one day. Not even one day, in half day. If you will go hospital and take forceps, kiwi, marina, everything is there. You will cover. You should know what is the basic protocol, what is the basic idea, and go through the topic. And in all these drills, what is this? Indication, contraindication, complication, procedure. That's all. So the
You're right.
main thing, how means you have to be focused, targeted. Some students, they are having a habit, they will read a full detailed guideline, and once you will close, next day you will, it's not possible to remember all the points of guideline. Believe me, it's not at all possible. After 3 days, if you ask yourself what you have read 3 days back in the guideline, you will remember only few points. But if you will discuss with your study partner, you will remember at least 50%. But if you read alone, only 10 to 20%, not more than that. So be targeted, be confident, always be interactive, search your study partner, always do discussion, because those discussion points only you will remember in the exam, believe me. So here, courses, don't worry, we will guide you again during the live sessions, each stations how to perform. And you have to go through the YouTube. Nowadays, YouTube is everything is available there. If you have any query, just put in the topic, everything will come. You can see everything there. Books we already discussed, study partner I told you, and definitely we will get success. Okay. Again, I told you it's all about day performance. Some students, they are very confident throughout the 3 months, and on the day of exam, they are not much confident. So it is all about the day performance also. Luck also. Be self-confident, avoid fear, whatever attempt, forget about that. After passing your exam, nobody never ask you how many attempts you gave. Do targeted study. Don't go into detail of each guideline, detail of every percentage. No need to go. And stay healthy and try to help others also, and practice daily. That is the only But again and again, I will tell you, practice at least 8 to 10 stations daily. So I would suggest you don't study at night time. Some people is having a habit late night, they are having a study, but please avoid that. You have to avoid in the night time, and please read in the peaceful place. Should be good light, proper positions. So that would also help you. And try to use the flashcards, notes. Try to make your notes. See, nowadays in structured discussion, if you have viva with the examiner, so what question from the guideline examiner can ask you, you have to ask yourself. Means whenever you are reading the guideline, any guideline, ask yourself, what could be the possible question examiner can ask me from this topic, like forceps, okay? So forceps is simple topic. It can come as a structured discussion also, it can come as drill also. So what are the points in forceps? Indication, contraindication, prerequisites, procedure, how to apply, and what is the care of the patient after the delivery. So like that, in each topic, where whatever you are reading, guideline, talk, ask yourself what are the possible questions. And again, in the talk, I would suggest you don't read the full talk, only try to focus on the table and flow chart. Always in MRCOG part 2 and 3 also, question always came, even the MCQ also, from the table. So tables should be on your tips, and that is also for important talk, not all the talk I'm telling you. And try to make a flashcards. And we are also sharing so many flashcards now. Yesterday only I shared, go through those important topics, important flowcharts. That is also more than enough. Like premenopausal ovarian cyst, postmenopausal ovarian cyst, there is nice flowcharts of those guidelines of both of the cyst. So that is more than enough. Only heading point in the guideline, and at the end whatever the table and flowchart, that is more than enough. And you have to highlight all the points. It would be easy for you at the end only to focus on these points last 3 days. Clear? And put a timer whenever you are performing the station that you have to complete this in 10 minutes. Till that point, everything is clear? Any query? Aisha, Poonam?
No, thank you so much. Please share that list that you were talking about.
Yeah, sure. I will share with you. And one more thing I want to ask you, this thing. So like as Dr. Shabnam explained you, and Dr. Anam also explained you what could be the possible stations. So it was already discussed by them. So you all know what are the different kinds of station and how to take the history, and what are the basic technical and complex technical skills, and how to break the bad news with the patient. This is the very important points of communication. And here again, same, which was discussed with you by the Dr. Shabnam. So now come back. I want to show you, yeah. So what is the points, important points which we need to cover in our obstetrical template? Like if any patient, suppose she is diabetes or hypertension or anemia. So just remember one point, whatever the case, you have to ask with the proper introduction. You have to say your name also, and you have to ask from the patient also name. Then ask how she want you to call her. Okay, take permission. Then age and education is very important, because here most of the time in Pakistan, whenever short case and patients are there, they are not educated, so maybe they will not understand much. So according to that, you have to ask in the beginning what is her education, so it would be easy for you to explain. And in that case, if she is well educated and she understand everything, then it would be easy for you to explain her in a better way, and you can use some medical terminology and some English also. But if they are not well educated, then you have to explain everything in the Urdu language. And what is her complaint? First ask basic complaint, for what she came in the hospital. Then ask detail about that complaint, like hypertension or diabetes or low hemoglobin. So first ask about detail of that, then complete your rest of the history template in obstetrical case. Same will happen into the gynae case. If patient is came to you with heavy bleeding, with passage oculars. Then your first job is to ask presenting complaint and complete your HOPI questions in view of heavy menstrual bleeding. Everything you have to ask in the HMB. How many pairs, intramenstrual bleeding, postcoital bleeding, dyspareunia, dysmenorrhea, cervical screening, and contraception. So each and everything you have to cover. Then you can complete your rest of the history template. Okay. So then you have to complete this past medical surgical. If she's telling you any past medical history, then again you have to ask detail. If she's telling you surgical history, like suppose if any patient is coming to you with bleeding in early pregnancy, maybe she's a case of ectopic pregnancy. Maybe she will give you history of previous also ectopic pregnancy or previous miscarriage. Then we need to the detail about the previous surgery. Either she had methotrexate or she had salpingotomy or salpingectomy. Because on the behalf of that, you will counsel the patient accordingly. So each and every point is having a marks in the exam. You have to cover accordingly. Medication history again important. If she's allergic and if she's telling you she's allergic to Bonistan or she's allergic to Brufen, always say, I will document. I will write in your file. So when your next colleague is coming, so she will understand that she will not give to that this medication to that patient. So you have to write in the big letter in her file in the top that she is allergic to this thing. So these are basic points and it give you marks in the exam. So be careful whenever you are taking history, and always if any patient they are giving you scenario, she's planning for the pregnancy and she's having some kidney problem or some major problem like SLE. So in that case, again, we have to ask a detailed history, and if she is not fit and they are giving you investigation that she is taking some teratogenic medication like mycophenolate or anything, then in that case, or she is taking methotrexate, so it means she is not fit for the pregnancy. So be careful, whatever the scenario they are giving you in the exam, read carefully in their 2 minutes instructions. And then in that 2 minutes, you have to ask yourself what history point are important you need to ask from your patient, and how will you plan a management? What are the points which you need to discuss with your patient? So this is the basic template. You can go through that. It would be easy for you and it will help you to remember all the points in the exam. Clear?
Yes, I'm clear. Thank you so much.
Yeah, this is again antenatal care. What are the points which you need to cover? Always mention the MDT. Don't forget MDT in any case. Because see, if patient is diabetic and her sugar is not very well controlled, definitely you will call the diabetologist to come and adjust the insulin dose. And sometimes if insulin we are going to start, still patient is not responding. Again, we need to call the diabetes doctor to come in if he can change or he will adjust the dose. So, and if patient is asthmatic, definitely you will call the pulmonologist. So we are not the alone on the floor who will manage everything. Okay, even the eclampsia patient, we are calling the anesthetist also. So don't forget in the exam word MDT, and not only say MDT, which team of members you have to mention in the exam if you have viva with the examiner of the any case. So you have to mention all the names of this. And second thing, if antenatal care case, these are the basic things which you need to cover in the structure discussion with the examiner also, and also with the patient. Like how frequently you will call the patient. That is again depend upon the case to case variation. Okay, there is one good, nice guideline on antenatal care. I would suggest you go through the table, go through the recommendation. Only one paper is enough. You will remember antenatal and intrapartum also. New guideline came now about the CTG. So you have to remember those points. Definitely, maybe they will give you one CTG paper, but you have to explain according to the new intrapartum guideline on the NICE. So there is different points now, white, amber, and red. So according to that, you have to explain to the role player if it is teaching station, if it is viva with the examiner. So, and sometimes dating is cane. Dating is cane in Pakistan, I would say it is very important. Why? Because most of the patients, they are not remembering their last date of cycle. Sometimes they are giving you history, Eid time or Ramadan time or Muharram time. So these also you have to write since last 1 year. In 1 year, when Ramadan, which date was Ramadan, which date was Eid, Choti Eid, Badi Eid, everything you have to write. Then you will not be confused in the exam when when that patient will tell you that my last period मुझे नहीं पता रमादान में आया था, then at that time you should have basic idea in your mind that yes, Ramadan was on this date. So it would be easy for you also to calculate. And second point, because most of the time patient also not having a dating scan also. Sometimes they are coming late. Sometimes only they will come if they have any problem. Otherwise, in Pakistan, most of the ladies, they are coming only when they are getting labor pain, no investigation, no any antenatal checkup. So you have to write all these date in your notes, when Eid, Badi Eid, Choti Eid, Ramadan, everything you have to write. Then it would save your time in the exam. And the Down syndrome screening, anomaly scan, if they have done, if not, depending upon the case scenario, if they are giving you 10 weeks, then you have to discuss all these things. That's why this time they gave you only patient and management. They are telling you to discuss with the examiner in the next room. This is the reason why, because they want to assess everything from your side. So you should have a basic idea, basic antenatal, and what is the difference of antenatal care of the different medical disorder cases like sickle cell disease, thalassemia, renal. Monitoring is different, intrapartum monitoring is different, antenatal is different, postpartum. VTE prophylaxis guideline is very important. You should know what is the risk scoring, how will you calculate risk scoring 1, 2, and 3, and which patient you will start heparin from the beginning, from the booking, and which patient you will start from 28 weeks, which patient you will give 10 days, which patient you will give 6 weeks. So all these things are very important viva points which examiner definitely will ask you in your any obstetrical case. Clear? Till now everything is clear or any query? So the same that VT prophylaxis, medication review. Medication review in that sense, if any patient is having a renal problem or diabetes patient, like if you have increased the dose of insulin in the intrapartum, definitely you have to reduce the dose in the postpartum. Again, this is patient safety point. And you have to discuss with the patient about breastfeeding and different positions of the breastfeeding you should know. So these are the some basic points. And debrief in case of any complication, like if at all patient is having a bladder injury, ureteric injury, or patient is postpartum hemorrhage, then next day we have to go and meet with the patient. How is she feeling? And we have to write the incident report. So in Pakistan, it is not as much important, but at least we have to go and meet with the patient, and we have to documentation is very important. Any complication, what happened with the patient, what time you call your senior, what time you call your consultant, what time they came. So everything you have to write in your file. Contraceptive advice is very important in the postpartum period and follow up. And again, you have to discuss if in case she's planning for next pregnancy, preconceptional. Now coming to the teaching approach, may I know anybody is having any idea what is the meaning of this teaching? How to give a lecture to your junior and how to explain to your junior? Anybody is having any background knowledge?
Yes, we first of all give the objectives, and then we, after introduction, we ask what are the expectations of the student. We assess the background knowledge of the student, and then we one by one we cover the points of our agenda, and finally we give patient information leaflet or study links, and
No,
we
no
ask for
patient
feedback.
information leaflet. No. In teaching session, no patient information leaflet because you are teaching to your junior. Patient information leaflet is for patient. For junior, you have to give them guideline. Like if you are giving forceps delivery, if you are teaching her forceps delivery, you have to say this is the GTG guideline on forceps on instrumental delivery. She has to go and read, and still she is having any query, she can come to you at any time. So teaching, you are junior, so no patient information leaflet, only whatever the material like GTG, nice, talk, depending upon the topic. And ask what she want to learn. What is she know about background knowledge of that topic. And whatever her task means, if she's asking you about perineal tear, okay, and she want to know what are the types of perineal tear, what are the suture material and everything. So your job is only whatever she want, you have to explain that much. You will not explain a full guideline in 10 minutes. So this is situation awareness. You have to ask from your junior what she want to learn and why she want to learn. What is in her mind? Why she thought that she has to learn forceps and she has to learn this vacuum? Why? Is there anything in her mind? Maybe one day before she has done duty and she was not very competent, or maybe next day is her duty in the labor room and she want to learn how to apply forceps. So whatever in her mind, we have to ask, and according to that what she want to learn, we have to explain that thing only. And apart from that, if she is having any other question, definitely she can ask you. Okay, so explain to them what you will teach. So then you have to explain which topic you want to explain and what is the point in that topic you want to explain and what are your expectations. And at the end, ask how is the session, what she learned from you. If you have given 10 minutes lecture, does she understand or not? So deliver the teaching means don't give lecture, means you have to ask in between. Whenever you are giving information, give information in chunks, with the patient also, with the junior also. Don't just give in one lecture. In between, ask, do you have any question? Am I clear so far? Are you with me? This is with the patient. But with the junior, whenever you are telling anything, suppose indication of forceps, ask. If suppose our name is Meena or whatever, then ask, Meena, can you repeat for me? What are the indication? So in that way, it is interactive. It is interactive session. You will understand whatever you are telling, your junior is understanding or not. So we have to ask these questions. And if she is telling you whatever the indication, then if she is telling you again, you have to appreciate. You have to appreciate that. Very good, Meena. You are a very fast learner. So these are the some tricks. This will gain marks in your communication with your colleague. Again, I told you in the beginning, colleague must be junior, must be senior. Anybody, even though GP, doctor, nurse, anybody is your colleague. So if you are giving teaching session to your junior, and again you will gain marks on your communication with your junior. And if she is performing anything wrong, don't say, no, no, Meena, it's not like that. You are doing wrong. No, no, this will affect on your communication marks. Then again you can say, I am applying this forceps, you can see, and accordingly you can repeat. Don't say you are doing wrong, things like that. You have to ask in the end, invite the question, summarize what you have taught, ask her and give feedback, gain feedback. If you telling that how was the session, and if she is telling you, yes, Aisha, it is a very nice session, I learned a lot. Again, you have to tell your junior, yes, Meena, you are also very fast learner. So definitely you can go through this topic and we will discuss again further in detail. Thank you and nice to meet you. Like that, you can complete your session. Clear? And
Yes,
these are
ma'am.
also important
Thank
points.
you.
Don't forget. And whenever your examination, some patients are not comfortable. So if they want to call someone like midwife or relative, anybody, they can be there. Introduce, and when to call for help, you remember hand washing, documentation is very important. So these are some important tips you have to follow. And then according to that, whatever the findings, you have to open and honest, whatever the breaking bad news, Down syndrome, everything you have to clear explanation give to your patient. Okay, so these are the interactive session also, interactive session with role player, static drills, labor board, gynae board, which was already we have discussed by Dr. Anam. So again, I would tell you, be positive, be calm. Exam is simple, it is not as much tough, and be empathetic and caring with your patient also, with your colleague also. Clear? Any query, anything?
Thank you.
So if you have any query, you can ask at any time. Me, Anam and Shabnam, we all are there in the group. And we hope we'll start our live session from 24. First session will be taken by Dr. Anam. So please be ready on time and try to present. Okay. Once you will present more, then only you will understand where is our lacking points.
And one thing more, Poonam, you four supposed to
Yes.
should be present in the live session. So you guys
Hmm.
should have the opportunity to present in front of us, because you guys will present at least 2 stations in every session.
You want us to present in every session?
Yes, I was told by ma'am that I will get a chance to present at least 2 stations in every session. Is that so?
Yes, that is what I am
Yeah.
saying, that at least you guys should be present in every session, because we have
Yes,
almost
yes.
eight stations for you people.
Yes,
So, and
okay.
you are four, and that is the good opportunity for you to present at least two in every session.
Yes, inshallah. I will be there.
If you miss, then
That's why I'm
definitely,
telling you. Mm-hmm.
okay.
Okay, I'll try my best to be there,
And
inshallah.
try to be composed, because see, in 10 it is not possible at all to speak the whole guideline in 10 minutes. So the basic point is you just to be composed, that what to speak and what not to speak. This is very important in this exam.
Will we be given the topics to prepare for live session, or will they be random topics?
If you guys want, we can give you some
I think
topic.
you should share about 10 topics that we should prepare all of them, and out of them anyone you can ask us. I think that will be a better idea. What do you say?
Okay, yeah, that is no problem.
Okay.
I will share with you. Yeah, that is no problem. Okay, I will share at least 15 topic, not 10.
Okay, okay,
15 topic. So you have to prepare those 15 topic before your live session. Okay.
okay, okay,
So out of those 15, you will get 8 stations.
okay. Done.
So first session is 24. So time we
We
will
have
adjust
3
in
days.
the
We have three
yes.
days, so we will cover
Yeah.
5
So
topics
now
daily.
only I will now only I will share. Don't worry. Hello.
Okay.
No, voice is breaking. Who is there? Hello.
We can prepare 5 daily, and we'll cover in 3 days. We'll cover 15 topics, and out of those
Yes,
15,
yes.
you can assess us. Okay.
Yes, yes.
Okay. Thank you.
Thank you. Any other thing,
Okay,
any other query?
one thing I want to add, I just want to add one thing. You all seems very anxious about it. You have so much to do, you have so much to cover, and you have very less time, right? So I just want to add few important points that please keep a note of it. The basic theme, the basic scenario of each and every station is similar, like the start, the end. In all stations, whether role player station, whether structured discussion with the examiner, or whether it is a original patient, in all the patients, you have to cover the specific domains. Like information gathering, you have to cover in all. If you know the history taking points of an obstetric patient, then you can take history of any patient, no matter if she's a role player or patient, or you are speaking the history points to the examiner. Okay, the history points are same. Just the communication way or the medium of communication, the medical, non-medical, English and Urdu is different. Otherwise, the things are same, which you have to keep a note of. Okay. In the same way, the management, the investigations, they are same. So the pattern is actually same. If you are having a real patient in the management, you will discuss about the journal management, specific management. You will explain the journal things like MDT, like explanation of diagnosis, journal management. You can implement in each station. So even if you have any different station which you are not able to cover in the specific designated time, still you can implement the journal things in the station. Okay, and the specific things you can just add on from your background knowledge. So in this manner, if you are able to prepare the specifically for the journal things you have a grip on, then it will not be a difficult task to attempt any station in the exam. Even though if you miss any specific point, at least 60 or 70% of the task will be done. Are you all getting my point?
Yes, yes, we are getting it.
This is a very important thing, because like if you have any skill station, so in the skill station you have to like any forceps, any vacuum, any marina, any other thing, you have to confirm the indication, you have to rule out any contraindication, you have to fulfill prerequisites, you have to perform and each and every step, starting from the position till the till you are done with the with that specific task. And then you have to document the findings, and you have to explain anything to the patient if you have to, any post-op care. This is same in every task, in everything, whether you are performing in front of the examiner or whether you are teaching your junior. So if you have skill in any form, if you have any drill in any case, you can at least cover these important points. And the specific thing, the specific task for each drill, the performance task, even if you don't know about it, you can at least try to perform from your background knowledge of your training and of your applied clinical knowledge. So this will be an easier task for you if you just keep your mind open in the exam. Is that clear?
Yes, ma'am.
So don't keep your mind narrow. Don't think that you are not able to do it. There's nothing in the exam that will be very much out of the syllabus and you will not be knowing anything about it. Most of the stations are usually those which you have done already, or at least even if you haven't done, you will be knowing about it. At least some information you will be having. So just try to implement that information right there and then in the exam. At least you will be having some marks rather than having nothing. Okay?
Okay, ma'am.
Yeah. So just try to work on it. Try to make the basics strong. If you have your basics strong, then definitely you are going to pass this exam in this go. So don't worry at all. We will on 24th of September on Sunday, we will be having our first session. I will be taking the session and I will share the list of tasks which I will be assessing, and I will be assigning the task randomly. Okay. So
Okay.
you will, all of you will not be knowing that who is going to have which task. So
Okay, we'll
like this.
prepare all 15 topics.
Yeah,
Yes.
exactly. I just want you all to prepare each and every topic. So don't be stick to one topic that I have to do this or I have to do that. Okay. So you all
Please,
have to prepare.
please adjust
Mhm.
the timings of the class in such a way that it finishes till 9 p.m. please.
Okay. Yeah, we can discuss about it. What time is comfortable for all of you?
At 9 p.m. I have to, I'm busy with my kids every day. So
Okay.
9 p.m. After 9, I'm not free. But before 9, I can manage any time that you tell.
Okay, we can manage before 9. We can start at around like 4 or 4 or 5 p.m., whatever you all will agree about. So we will discuss in the group, okay? We will ask everyone and then we will finalize a time. We will keep a note of the problems which everyone have. So we will have an agreed timing for the session.
Okay. And also, I wanted to ask you, will the recordings be available?
Yeah, exactly.
Yes, recording will be available. We will share with you all in the group. Don't worry.
Okay, thank you so much. Thank you.
Okay, if you still any query, feel free to ask any question in the group also. So we will discuss in detail in our live sessions. Okay.
Okay, thank you.
Okay, thank you. Thank you, Dr. Anam, Dr. Shabnam.
Thank you, Dr. Gauri.
Thank you, Dr. Gauri, Dr. Shabnam. Thank you, guys. Thank you so much, Aisha, Poonam, Mehreen. Safia, and many students were there. So thank you so much to all of you for today's attendance, and we will be looking forward for the sessions too.